Screening mammograms are very important to be obtained on a very regular basis, in fact yearly, because they can detect early breast cancers, they can detect precancerous situations. 1 in 8 women is at risk for getting breast cancer in her lifetime, and so we want to detect it, and we want to detect it early. Women age 40 or over should be getting yearly screening mammograms. Family history can be very important. If a woman has a mother or a sister who has premenopausal breast cancer, say at age 42, you would start screening 10 years before that. So at age 32, you would actually start getting your screening mammograms. During a mammogram, you go into a changing room, a private changing room, and you disrobe, and you then put on a gown or some sort of wrap to cover you up. Then you're led into a private mammography suite. It's just you and a female technologist. She will position you into the mammography unit. She will compress your breasts. Each breast receives 2 different views, one from top to bottom and one kind of from the side. Each time you're in compression, the compression usually lasts somewhere between 30 seconds and a minute. Usually she will step away while she's taking the picture. She'll go nearby in the same room to the control panel. We'll take the picture. We'll have you hold your breath. The whole process, I think we schedule maybe 15 minutes for the whole process. It generally doesn't even take that long unless you're hard to position. One of the common misconceptions is that this exam is very painful, and truly it is not. I've personally had mammograms, and they can be uncomfortable, but they are not painful. You want to try and do your mammogram and schedule it around your cycle so that it's not the first day of your cycle when your breasts are going to be tender. You would want to do it sort of mid-cycle. That would be one time that would be helpful to do it. Another thing that we use at certain institutions also uses something called a mammo pad, which is a little cushion that you put on the plates that are used for compression, and that sort of helps with any kind of discomfort that you might have. One of the other misconceptions is that mammography can diagnose 100% of breast cancers, and actually it is not a perfect test, unfortunately. It is the gold standard for screening, but it is not 100% perfect. It's about 85%. So it is a very good screening tool, it's just not 100%. Another misconception about mammography is that every time we see a mass, that means it's cancer, but that's not true. Most of the masses that we do detect by mammography are actually non-cancerous. About 90% of the time, the things we find by mammography are non-cancerous. So even if you get a letter from us saying that your mammography exam was abnormal, that doesn't mean you have cancer. Basically what happens if you come in, you get your screening, we call you back, you get a letter in the mail or a telephone call generally that says you need to come back for a diagnostic mammogram or an ultrasound, then what happens is if there's an abnormality that requires biopsy, one of the radiologists then and there will come and speak with you. You know you have something wrong that requires a biopsy. Then what happens is we call your doctor's office and we recommend a biopsy. They send us an order if they're going to do the biopsy here, and then what happens is one of our nurse navigators will call you. We'll speak to you over the phone, we'll talk to you about the procedure, we'll start their contact with you right then and there. If it's benign, great. They're done, you go on your merry way. If it's not benign and it turns out cancerous, then they work with you. They make sure that you have follow-up with a surgeon or whoever you need to follow up with. And after your surgery, they still make sure that you're following up with your oncologist, that you've got this care, and they also make sure that you have access to our many support groups or a support group. They make sure about your emotional well-being as well. It's not just about your physical health, it's about the emotional health as well. Shawnee Mission is a great place to come have your breast care. We are accredited through the American College of Surgeons. They have a national accreditation program for breast centers, and that's a big honor to receive. And we also have just wonderful staff here who've been at this for forever. Our mammography techs have been doing this forever, and they really treat our patients with a lot of kindness, which is just amazing. And we have these wonderful nurse navigators who lead our patients from beginning till end. If they're diagnosed with breast cancer, they lead them through the whole process. They are available for phone calls morning and night. They lead them through support groups, all different kinds of things like that. They make sure they follow up on their biopsies, etc., make sure they follow up on oncology appointments, that sort of thing. So they have someone to guide them through the process. We also have very subspecialized physicians, including our radiologists, our pathologists, our surgeons, and we all are very experienced at taking care of breast health. And so that's a wonderful thing as well. And also we're a very comprehensive center. Everything in the breast or the women's center is very close by. You can get your MRI, you can get your breast ultrasound, you can get your mammograms all within walking distance. And on campus we have oncology, we have surgery, we have pathology. Everything you need is right here on the Shawnee Mission campus. There's absolutely no reason not to get your screening mammograms. I mean, I know there are some financial reasons people have for not coming in, and there's the fear of, I don't want them to find anything, so if I don't go, they won't find it. But if we can find something very early, which mammography can do, it makes it so worth it. Because when you come in and you have a giant mass that's metastasized, it's too late. We want to find things before that happens. I'm Kimberly Roys. I'm a radiologist with Shawnee Mission Medical Center.